Hello, I'm Glenn W. Hunter, and with me today is Shore Denny, our subject matter expert, and we are the three C's of social emotional learning: community, communication, collaboration, and today's topic, COVID vaccine and mental health. COVID has just literally dominated our consciousness for the last year, Shore, and now we're going to put a mental health component. I mean, think about it. How does that thing, that one virus, I mean, how does it just impact us mentally? I mean, what's the connection?
Everything, freedom, liberty, health, life. It impacts us in every way. Our social society. We've been shut down for almost a year. The impact is endless. COVID has impacted almost every piece of our lives. That it's we can hardly find things in the stores now. Things that you used to buy are no longer there. So we've lost any continuity, right? I mean, we're now kind of in the air. We don't know what's going to be tomorrow based on what was yesterday. I think the main thing would be that nothing is like it was. Everything is different and new, and we really have no true guarantee of when things are going to get, if we would say, back to normal.
So there's the leap into the mental health world right there. We do not know when things are going to get back to normal. I mean, think about it. A year ago, pretty much we coined a term, the new normal. We can't
It just
go
keeps
back.
changing.
It keeps changing. Exactly. Exactly. So as we're thinking about that from a mental health perspective, think about some of the burdens that we actually have. So we have this new vaccine. We have a couple of them. Moderna has one. Pfizer has one. Johnson and Johnson has one on its way. You know, right
Yeah.
down the brink. Right. So we have this vaccine, and as it's being made available, people are using it. We're told it's not a cure. How do people even process that? Just the average Joe, the average Jane on the street.
And you have to get two, and it's not, and they're saying it's 95% effective. I mean, I don't get it. I think that what they're saying is that literally this is another shot that you would get each year, like the flu shot, because that shot supposedly is not a cure for the current flu. It's a cure for last year's flu or something like that. So I think it falls along that line, and that's why some people consider to compare this to the flu, because it's a viral disease, and up to this point, I don't think that science, up until the last 9 months, had found anything to, offset a virus.
So, I mean, that's a very important perspective you're putting out there that it may end up being something we have to take repeatedly, and that's going to continue to evolve. So now that we have another shot we have to take, if we go down this particular path, how do families, I mean, folks who are working hard, trying to be healthy, pay their taxes, raise their kids, how do they process the fact that they may now need to take an annual shot just to give the appearance of being healthier?
Well, I mean, let's just go to the whole experience of even getting tested, right? I think it's all because my point is going to be that right now there's no equity. Right now, what we see is I've had to get 3 tests so far. And I've gone and gotten tested. In the recent one, I went and they have this great sign that says, oh, you can get a rapid test. Now, you think about the people that are really going to get these tests that are getting exposed multiple times. It's because they're front line, right? There are first responders. There are delivery people. They're the people that are supporting us through this whole pandemic. So they're going, and they're not the richest people. Now they've got this rapid test. Now think of it. If you take the rapid test, in 3 hours if you have the virus.
Mhm.
Then you can do your precautions. You can quarantine, take the medications. You will now are not going back to work, and you're not infecting anyone at work. But what they do is they charge you $150 to $200 for the rapid test. Therefore, the regular person cannot afford that. They're going to take the regular test, which takes 2, 3, 4 days. And I think we're getting our results quickly, but up to 2, 3 days to get a result, which means now I'm going to work because I can't afford to sit at home. My boss is not going to let me sit at home without a diagnosis, number one. And I am going to have to go to work because I need to pay my rent. So I'm going to work until they contact me at work and tell me I have the virus. And then I'm going to go home. Therefore, everybody at my job is now contaminated and they have to go through the same process that I just went through. It does not make sense. There's no mental wellness. There's no mental security. There's no nothing here. Even for us as employees trying to survive, because our government is not giving us enough money for us to stay at home and wait out this pandemic. We have to work. And I think that at the very least, there should be a rapid test for free so that working people will know before they have to go and contaminate others because they have to pay rent. I just think that, this equity is very off here. The rich can find out very quickly. I'm in the middle, right? I have insurance. I went and I'm asking, a lady before me went and their test was free. They got it through the CARE Act, the funding of the CARE Act. But because I have insurance, I had to pay for the long test for 2 to 3 days to find out. Where is the equity in this? What if I cannot afford that copay? How do I get my testing? I mean, I think even from the testing that there is a lack of understanding of what mental support is, right? I think that there is nothing to cling on, no straight rope that I can pull going, okay, I'm going to do this step, and then there's this step, and through all of this, we're safe. The problem that we have and the reason that we're having these mental dilemmas is because no part of our system is safe. Even when you go to go get the test, unless you do the drive-through, you're in the presence of others that could be showing symptoms. So even while you're getting, tested, they have you sit in a car until you go in, but I don't think that any part of this is set up for us to be warm and cozy. I think that we are through every step of this. When I go get that test, when I come home, because I know that I've been in contact, what do I do with my babies? How do I interact with them? Do I cook dinner? Do I go to my room and am I now quarantined for 14 days from my children and my family? I mean, we don't have any straight guidelines. There's a lot of misinformation. So I think that not only are the adults, are we in a dilemma of not only what do I believe or, where do I go? Because all of that, we have the dilemma of our youth seeing this and living through it and the complete uncertainty of all of it. When mom drives off today to go and get that test, when she comes back, am I going to be able to hug her? Mm-hmm. Right? And she doesn't even know because her test doesn't come back. The results don't come back for 3 days. So now I'm looking at my 5-year-old, right? I'm looking at my baby, a 2-year-old. I'm looking at my teenager, whoever it is. I'm looking at my husband. Do I need to go to another room? Should I sleep separate? I mean, there are so many things that come into play with simply getting tested. And then when we come to the vaccine, and now we still have no mental security, there's no safety, even in that process, I think it's an overload. And I think that's why people are very hesitant to take the shot.
So we're able to look at it from a very personal point of view as individuals are making these choices or families are making these choices. But, as we look at it again, from a mental health point of view, which allows us to put a broader lens to it, we still have issues. There's no aggregate mindset that says, no, this is good and this is going to work out. We're being told that, but it still has to be embraced. So if you think about it, the vaccine as it is established now, it is not a cure. There's some mental health ramifications that are involved as people are trying to wrestle whether this is what's best for them and their family, or how do they manage bringing that in, not just for them, but for the betterment of those around them. So we have a community component at work here. So it's not a cure. We're not sure whether we should or we shouldn't. Are we being included or excluded? We're creating a lot of trauma. From your perspective, Shore, as a professional, what are some of the more important forms of trauma that the community is experiencing because there's so much uncertainty around what the vaccine will and won't do?
Well, I mean, that is the trauma right there, right? Because there is so much uncertainty, we've been shut down for a year. Basically, we have little openings and then we go back under. We have a little opening, we go back under. Many businesses have closed because of the uncertainty, because we as a nation weren't given financial support to stay at home and cover our heads for months until this is over. We find ourselves with it spreading. So there are so many ways that I've stated that we are traumatized through this all. The fact that I think we're just now starting to have funerals. And I know there are still a lot of Zoom funerals going on. So there's still a lack of closure for the over 400,000 people that have died from this COVID thing in America, right? There's the trauma of our government didn't actually do everything it could have in the beginning, and we're here. So there's a little mistrust of the authority that we should be paying very close attention to. Right now, we are skeptical. That's a trauma that came from this COVID pandemic that we're dealing with. And these things are all very unsettling because each of them is impacting us in our core. It's been in our core belief that we can trust our government up until 4 years ago. It's been a core, you know what I mean. I mean, as far as if there's a test out there, or if there's this COVID, we know that during the Obama period that Ebola was happening, and SARS, and these things never came to us. We trusted our government to handle those situations, and it seems that didn't happen here. That's what I meant by we trusted our government. But so that's a trauma, because now we thought somebody had our back and they don't. We know now that they don't. So how do we overcome these? How do we cope with all of the traumas that we're dealing with is what we come down to, right? And I think this is the thing that we've had to deal with the last 4 years. And that would be, is there truth? And who has it, right? So we would always, in college, we're taught, to do at least three references, right? You need sources, right? At least 3 sources, right? For your point. So I would tell people right now to look at different sources. Look for your information in different places. Always wonder who is producing the information you're looking at and if they're biased, right? Because somebody that's trying to sell you a sponge is going to tell you in their website how great that sponge is so that you will buy it. So you want to listen to somebody that's not going to benefit from the sponge. And what is it that they think? So we want to find facts and be able to settle ourselves or ground ourselves in some common knowledge.
As you're talking about facts and the common knowledge, there's also that trauma that's associated with communication, not just community, but communication also. I mean, historically, our government has used experiments on people to keep their public health initiatives moving forward. How do we know that's not going to happen in this environment? And how do we tie it into those previous experiences?
I can't say that we do know. How did we know then? How did we know when Gila was, happening? How did we know when they have done all of these things that they've done? We don't even know if right now there's a soul out there that has the dang, that's immune, and that they've taken that person and doing something with them. I mean, we don't know, right? I mean, based on history, it could be. So I think that what we, again, have to do is say that at this point, we do our own research on COVID and what it means. And then we look at our government now and hold them accountable. Now that we have some type of a semblance of normalcy in our government, we go back to what is normal, and that is pressing them for facts, pressing them to, be transparent and to give us the information that we need. I know many, many, many medical people that feel that this vaccination is the way to go. I want to make that known, that there are some really strong arguments for taking the vaccine, and believing in the creators of it. I think our public health systems are doing that. They're trying to make sure that everyone has, some semblance of the same information and truth. And I think that that's really all that we can do. So to cope, we need to find those sources that are public health sources, that are, sources that you can trust, or start learning to trust with your own knowledge. Use common sense, use critical thinking. Those are very important now. And I think that if we do that, we will be able to cope through this. Think of what is good for you, what's right for your family, right? We don't want to go out there and bring things back to harm our own people, right, in our own family. So think of what you want to do in your lifestyle that's going to keep you and the people around you safe. If you believe that that is taking the vaccine, do it. Take the vaccine and be safe. If you believe that it's not taking the vaccine that is keeping you safe right now, with the information that's out there, I just say that get more information and continue to try to get more information, so that if there's a point that you're going to change your mind, that you can do that and be safe with it. Feel safe in the decision that you make of moving from not taking the vaccine to taking it. Make sure that your reason for taking it, that you're doing it for the good of you and your family, I think is the key now. There's no central anything that we can really depend on until our government builds that trust again.
So you mentioned at the beginning of your comments there, HeLa. That was something that helped sort of fray our trust in the
Yeah.
government. Can you share that story for our audience a little bit, in case they're not as well versed in it?
I am not sure of the exact name of the lady. The HeLa project was a project that happened where they found a freaking cure for almost everything in the body of one woman. And I think her last name was Lords. And in that, they kept it a secret. They kept her alive. They took her cells and they used them without her permission to do things. And upon her death, they captured her body. They kept her body, and they are still to today using her body cells to cure things like AIDS, cancer, things like that. It's something that her family, they did a whole movie on it, and no one has ever been compensated even for all of the life-saving things that this one person's body was able to provide. This was an African-American woman, and I do have some stuff over here. Her name was Henrietta Lacks. That was her name, Henrietta Lacks. Look her up. In that situation, we have the Tuskegee the Tuskegee experiment that went on, with syphilis, where they took a group of brown people and tested them to see how they gave some placebos, they gave some syphilis. They didn't start with it, they gave it to them. So, there's mistrust in our country historically around brown people and what they could be doing to us. The fact that they gave this shot to the first responders and a bunch of Caucasian people in the beginning really makes you think. They gave it to the presidents, and so it makes you think that they're not out to get us. But then, there's that theory of what they're giving them might not be what they're giving us. So such mistrust is trauma. And the only way that I believe we're going to get through it is all of us having multiple sources saying the same thing that we can trust, and us seeing it for ourselves. That's the only way I think that we're going to have coping, is by our community being resilient and our our government being resilient and these pharmaceutical agencies being resilient and coming up with a plan that is equitable for everyone.
Wow. I mean, and there's a lot of layers even inside of that as you talk about equitable distribution of the resources that we have. Because the fact of the matter is, we are making great strides scientifically and from a medical standpoint with regards to these viruses as they evolve and other illnesses as well. So we can't ignore our competence there. We do have to make sure we're being respectful and dutiful with regards to how it's being distributed and that we are properly monitoring the safe distribution across all communities.
It's fearful. People are doing crazy things. Some people are contaminating vaccinations. Some people are throwing them away. I mean, they need to get a grip on the distribution of the vaccine, and I think that might help once they tighten up some of the things and the federal government takes over and starts supporting the states.
Absolutely. Absolutely. The integrity of distribution cannot be overemphasized. And the harsh part is if it is compromised, the public will know. You will start seeing pockets of our community, pockets of our population that are disproportionately suffering while others are doing well. So that type of integrity is important, and let's definitely hold our government officials accountable that they are acting with that type of integrity. Tell you short, there are so many layers that goes on with how COVID is affecting our mental health as a community at large,
Yes.
down to our families, our shopping habits, how we're treating school. All of that plays in under this one umbrella. And we just barely scratch the surface of how it can affect each and every one of us in various ways as we have to decide whether we're taking a vaccine, not taking a vaccine, whether we're in a work environment where it's required, who pays. All of those are real life situations that require real life decisions. And I thank you, Shore, for being able to provide some light, not just into the controversy, but into the ramifications of making those decisions that we all will have to make. So with that, you have to tell our audience, because if they want more, they got to let us know. We can have time. We have the resources. We can dig deeper. How do they contact us at 3Cs of SEL?
You can reach us at our website, communitynow.info, and you can call us at 951-413-6587. You can also reach out on Facebook at Community Now. We're open for any topics that we can get into, comments that you have, and we're just looking for support and ways that we can help.
By all means, and of course, with the channel that this goes out, give your comments, like us, follow us, tell a friend that these are facts that are being explored for the betterment of our community. We'll have better communication and we will have better collaboration. And the 3Cs of social emotional learning will help us with more functional folks. With that, again, I am Glenn W. Hunter. We have our subject matter expert, Shore Denny. And always, I implore each and every one of you singularly and absolutely, as you're out there in the marketplace, as you're out there in the world, be safe. Thank you.